3.
Today we are discussing a neck surgery, a front neck surgery, what we call an anterior, which means front, cervical, which means neck, discectomy, which means removal of a disc, and fusion, which means to merge bones together or grow bones together. So an acdf surgery is a surgery that spine surgeons like myself have done and do often many times a week. So I've done personally hundreds, if not thousands, of these procedures. And the indications for the surgery are neck pain and arm pain, and often interscapular pain, which is behind the shoulder blades. This is often due to spurs in the neck or calcium deposits, which are also known as spurs. You may have heard of the term degenerative disc disease, herniated disc, stenosis, which means narrowing. You may have heard of radiculopathy, which means nerve pain, generally going down the arms. An acdf surgery can be done under general anesthesia, and depending on how many levels are affected, can be 1 disc level, could be 2, could be 3, or sometimes even 4, but rarely 5 discs that need to be operated on. And what we do is we put the patient to sleep. We then open up an area on the right or left side in the skin crease, and then we're able to take your muscles in your neck and open them gently like a curtain. And then right then we're able to carefully move over the food tube and the windpipe, as well as the jugular vein and the carotid artery. And that gives us a nice big window right here to expose the front part of the spine. And then we bring in a microscope and a micro drill and can ream out this disc here in the spur and give the spinal cord and nerve roots more room. And then we can place a piece of bone, or often we use a piece of plastic with a patient's own bone shavings, and put it where the disc was that we removed. And then after that, we're able to put a titanium plate with screws. And I have a model over here that shows this. And it's simply, you have the bones in front, then the disc that's removed, then a spacer in there, and it's hollow in there where we can put bone in there, and then we put a plate and screws. The procedure itself, 1 level procedure takes about an hour, 2 level takes about 2 hours, etc. Patients often can go home that day and sometimes have an overnight stay, but most will go home that day after surgery. And after surgery, you're not going to lift anything greater than 10 pounds. You're just going to take it easy. We'll give you some pain medications to help. There are risks with any spine surgery that include anything from hoarseness of voice to difficulty swallowing or sore throat. Those are pretty common. Very rare and almost unheard of are paralysis, heart attack, stroke, or death. Sometimes patients over time will develop arthritis above the levels that they had surgery, but most people do quite well. In general, I have patients just relax and not do much for about 2 weeks. After 2 weeks, I'll see them back, look at their wounds, see how patients are doing, and then we would discuss about starting physical therapy. Kind of rule of thumb is you're off at least 2 weeks after surgery from work, and sometimes to a couple months. It just depends on the patient, how they're doing, and how severe their symptoms were before surgery, and then how much surgery we indeed had to do. But overall, patients tend to do super well with these procedures. It helps both arm pain and neck pain, and they are very happy with the surgical outcomes.